Hello, my name is Leah Kalk. I am a licensed clinical professional counselor and the director of the Idaho Radar Center at Boise State University. This week is National Prevention Week, and I've put together 4 short videos on different prevention topics. Today, I will be talking about prescription drug and opioid misuse. So, what are opioids? Opioids are pain relievers that are naturally found in the opium poppy plant. Some opioids, such as OxyContin, Vicodin, codeine, and morphine, are prescribed by doctors to treat pain, like after surgery or if you break your leg. They are prescribed to both adults and youth. Heroin is an illegal opioid that has a similar chemical makeup as prescription opioids. Opioid prescription medicine, as well as illegal opioids like heroin, can cause addiction, overdose, or even death. When they enter the body, opioids bind to receptors located in many areas of the brain and other places in the body. Then they block pain signals sent from the brain and also release large amounts of dopamine. This dopamine release can make people feel relaxed and happy, even euphoric. However, some other short-term effects include extreme drowsiness, nausea and vomiting, constipation, or even slowed or stopped breathing, which can cause a fatal overdose. Over time, opioid use and misuse can lead to insomnia, muscle pain, heart problems, pneumonia, and dependence or addiction. Having a prescription for opioids or other medicines doesn't necessarily make them safe. People can misuse prescription drugs in several ways: by taking a prescription incorrectly, like taking more than the prescribed dose, taking it more often than prescribed, getting and using a prescription pill from a friend or a family member, even if it's for a real condition, taking it specifically to get high, mixing prescriptions with alcohol or other drugs, or crushing pills or opening capsules and then snorting or smoking them, or dissolving the powder in water and injecting the liquid into a vein. Some people get addicted to prescription opioids and then switch to heroin. Others simply start using heroin. In some communities, heroin is cheaper and potentially easier to get than prescription opioids, which is why some people who are addicted to prescription opioids might switch. Opioids can be addictive. In fact, they are among the most addictive drugs. Regular use of opioids change the chemistry in the brain, which leads to dependence or even addiction. People who become addicted to opioids can feel a strong need to take the drug again and again. Someone who is addicted to opioids is also likely to experience severe withdrawal symptoms like muscle cramping, diarrhea, pain, or anxiety. The strong desire to use opioids along with these withdrawal symptoms can be so significant that it makes it difficult for people to stop, even if they are experiencing negative consequences to their health and well-being. Using illegal opioids and misusing prescription opioids increases the risk of addiction. Overdose is also a significant issue with opioids. Because of the way opioids cause slowed breathing, high doses of opioids or mixing opioids with things like alcohol or other drugs can cause breathing to slow or stop, leading to death if not treated immediately. Nearly 60% of overdoses in the United States are related to opioids. Now, there is an opioid antagonist medication like naloxone that can temporarily reverse an opioid overdose. If you use naloxone on someone, you should still call 911 because it is possible the individual could resume overdosing after 30 to 60 minutes. In Idaho, anyone who has a valid reason can ask for a prescription of naloxone to have on hand. How can you tell if your child has been misusing opioids? First, be aware of prescriptions in your household so you will notice if any are missing. If this is a concern, there are prescription lockboxes you can purchase to keep your medications safe. In Idaho, youth misused their prescription drugs most often in their own home. You can also look out for changes in your child's mood or behavior. Are they skipping showers, not brushing their hair or teeth, changing their eating or sleeping habits, struggling in their relationships with family or friends? Are they skipping classes or missing days of school? Are they getting in trouble at school or with law enforcement? If you are noticing these kinds of changes, it could be related to opioid use or other drug use, or it could indicate other problems. The good news is opioids are not the only effective pain relievers. You and your child can talk with your doctor about other options for pain. If your child is prescribed opioids, make sure they are taken exactly as the doctor prescribed. If you or your child have leftover medication, dispose of it safely. This is an important step because more than half of people aged 12 or older in the United States who misused prescription pain relievers in the past year obtained them from a friend or relative. If you aren't sure how to safely dispose of your medication, the Idaho Office of Drug Policy has a prescription take-back program, and I have listed their website on this slide. Also, each day this week, I will include one general prevention tip. Today's tip is practicing refusal skills with your kids. You can come up with scenarios that they might encounter, such as a friend offering them a pill from their parent's prescription. Then brainstorm with your teen maybe a direct refusal, which is something as simple as, "No thanks, I'm not interested." And you can role play these. You can also practice coming up with ways they can exit a situation they don't want to be in. Things like, "Oh, I need to go make a phone call," or "I need to go get a drink of water." Another refusal skill to practice with your teen is getting help. This could be setting up a code word that they can text you if they need help getting out of a situation quickly. Thank you for listening. The Idaho Radar Center provides free resources and materials on drug and alcohol use prevention. For more information, please visit our website.